Hello, this is Resilience Radio, episode 21 with Mary Carney on public health. I'm Irvin Eisenberg, host of the show and owner of Resilience Occupational Therapy. As always, the opinions on this show are not necessarily shared by me, and I like to feature a variety of different perspectives. And everyone has their own different needs and perspectives as to what they get out of health-wise out of the show. Additionally, this is not meant to be medically diagnostic or prescriptive in any way. Today's guest is Mary Carney. She has a master's degree in public health and community health education. It's really great to have you on the show today.
Thanks, Irv.
So, I wanted to have you share a little bit about your background and the work that you do.
Sure. Well, I've been doing different types of public health work for about 20 years now. Although at the beginning, I don't think I understood the things I was doing as part of public health. But I started off working on environmental and public health policies. I've worked doing health education activities. I have worked supporting a major health research study. I've coordinated chronic disease prevention projects. I've served as an evaluator. I've worked assessing population health data. So I've really done a lot of different things in the field.
So it's a very broad field, but could you define for the listeners what is public health?
Um, sure. It's the field focused on preventing disease and promoting health. We focus on the health of whole populations as opposed to individuals for the most part. And, I think a lot of times people have an idea of public health, based on maybe, a narrow frame of mind. Like they are the folks that are preventing infectious diseases like COVID, for example. But public health is much more. I mean, it's everything from creating environments that make it less likely that people will have health issues down the road, to looking at the data and science on what diseases people have, what's causing them, to the work to do better screening and treatment. I mean, it's the full spectrum. there's quite a range.
So do you feel like there's any really good public health measurements, indicators of public's health that the listeners might not be aware of, or that are worth highlighting?
Oh, there are so many indicators we use in public health. We're kind of at this point where we are overloaded with more and more quality data in the field. So when health departments are doing, assessments of the public's health, they have, hundreds of data points they're looking at now. It's really hard for them to narrow down. Traditionally, we looked at life expectancy. We looked at infant mortality. Those are, some of the classic public health data indicators. But now we have, data on so much more, and, people are much less likely to be dying of infectious diseases and, things that we paid close attention to a century ago, and much more likely to be dying of chronic diseases like diabetes and heart disease and cancer. So we look at a lot of data on those things.
So I guess
it's very hard to narrow down.
Yes. So I guess beyond these sort of more quantitative indicators, what do you see, or what do you envision for a community being healthy, beyond sort of the obvious life expectancy and not having disease? What does health look like in a community?
Well, I think about, an environment that makes it easy for people to make healthy lifestyle choices. A lot of the work I try to do is more upstream and focused on, creating policies and systems that support health in the community. So for example, I, have worked on smoke-free housing policies for, big apartment complexes. So, we're working to create smoke-free norms in places. There's the smoke-free indoor air policies we work on, nutrition standards, policies that dictate there will be walkable communities and crosswalks and more infrastructure that supports walking to get where you need to go, or active transportation in communities. And all of those things are what I think about as maybe the most important factors influencing people down the road, even though it's very hard to point to specific individuals who benefit from those specific changes, because they work on a population level to create environments where it's easier to be healthy.
So, what types of public health initiatives can you point to that were very effective, either the ones you were involved in or sort of studies that you've seen that were sort of very effective in improving public health overall? That sort of, yeah.
Sure. Well, just to talk about tobacco a little more, I guess there's tons of research on the benefits of those smoke-free indoor air laws. When I was a teenager, smoking in restaurants and bars was totally normal, and I thought it was never going to change. I was shocked when policies were adopted that, a New York State law was adopted 20 years ago, maybe 15. I honestly can't remember exactly when, but that's had a huge impact on decreasing the rates of people smoking. And there's research to back it up in, states where these smoke-free policies get adopted, smoking rates go down. There's also, traceable research showing that there's benefits to raising taxes on cigarettes. That causes people to smoke less. Raising the legal age to smoke to 21 has had an impact in many communities of decreasing smoking among youth. So, there's lots of research on the policy changes and things that public health focuses on that back up what we do.
So when I think about public health policy, and I think about sort of unintended consequences sometimes of policies, and of course, any policy you've mentioned, I'm sure there's people who have come up with all sorts of reasons why those initiatives may have been problematic, and it sounds like
Mm-hmm.
from what you're saying, they've been fairly effective, but it's sometimes hard to tell until you've got hindsight what's effective and what's not. The classic story of the Cobra effect
Mm-hmm.
in sociology, or in general, where I think it was in India, they were trying to decrease the cobra population, so they put a bounty on cobra tails, so people started breeding cobras, which caused a problem, and then they decided they were going to stop putting a bounty on cobra tails, so all these cobra breeding areas released cobras. So in both
Mm-hmm.
cases, changing the policy actually had the opposite effect.
Mm-hmm.
How do you, when you're thinking about public policies or sort of pushing for an initiative, how do you make sure you're not falling into sort of a cobra effect, having the opposite effect of what you're looking for?
Well, I think the key thing to consider at the beginning is community engagement and making sure you have people from the community really at the table and engaged in shaping the policy that you want to see. It's never a good idea to come in from the outside with ideas and, impose them, right? You need to work with the community, ideally, and bring them along with you. And I think that those make the stronger policies. Just to look at, a policy that's, not a law or anything happening at the municipal level, but to look at a like smoke-free housing policy on a building level, let's say, if you want to make that change, and make it effective, you need the people from the building to want it and to be driving that. I, had lots of experiences, not recently, but when I worked on that kind of issue, where, there were people from the building who were absolutely, 100% opposed, and then others who were, very much in for it. And, you have to go at the pace of trust with the community and bring in, the research and the ideas along with respect for people's knowledge of what's going to work there, and create a policy that makes things work. And the tough thing about policy change especially is that you're changing the norms for people. Nobody likes change, to be imposed, and even if they do ultimately like what the change results in, what you get to witness as the public health person is usually the growing pains and the part of the process that involves people, having emotional reactions and, wrestling with whether or not this is something they can accept and deal with. So it's, not easy to create a policy change. And, I think the best changes are well planned, have the community behind them. They're evaluated well. So you've got like a plan to regularly assess how well they're working and, look at the data afterwards. And they're flexible, imposed over a long enough time where you can adjust course midway if you need to. So it's not always possible to get, things done in the ideal way, but that's how I like to think about a good public health change.
Do you have any examples of either work you've done or other policies on a more micro level than like a large New York smoking ban, um, where where the public has really been listened, as an example of where the public's really been listened to, and or where the people initiating the changes have been flexible to feedback?
So one thing that comes to mind is, some of the work on vending machine policies. Um, you know, Often work sites who want to improve the health of their employees think about changing the food environment at their work site if they have a cafeteria or vending machines. And I know of some work sites where that there was quite the mix among employees about whether to change what was in the machines and make their healthier choices available. So there were taste tests done. There were meetings where they brought in some of the options from vendors that were lower in salt and sugar, and gave people choices and let them test taste and have input as to what happened, and which vendor they chose. So that's a good way to deal with it. I think an ideal way is if you can get like actual engagement in, how to solve this problem, how to make things better, and in the process, educate people a little bit about what they've been consuming, or in this case, what they've been consuming that might not be so good for them, and why it makes sense to have some better choices out there.
And it seems like a great example of having being able to actively taste the different foods and sort of make it a fun activity gives you buy-in and sort of investment in the change
Yeah.
that's taking place. So I obviously we're still in the middle of a pandemic, and people may or may not be listening to this show during a pandemic. It seems like when we're talking about public health, while I want this show to be sort of timeless in the sense that the things we're talking about are useful to people regardless of whether they're living in this bizarre COVID time, what lessons do you feel like we, the public in general and public health people, should be taking from COVID?
Oh,
I know it's kind of
well,
a
that's
big
a big,
one.
yeah, it's a big question. I mean, I have a lot of thoughts on that one. I mean, uh, when this began, I think there are many people in the field, myself included, who never thought that leadership could do so much damage to undermine our public health infrastructure and really um, undermine good guidance about what to do. I mean, I think I don't want to get partisan, but I think that there was huge damage done by the Trump administration last year that made COVID in this country much more deadly than it needed to be, and much more destructive on a, in every way. It's been destructive, disruptive, and I think the politics of uh, public health really need to be examined. So we have some systems in place to make sure that the research and the epidemiology and the Dr. Fauci's of the world are guiding the decision making at the top levels for emergencies like this. Because it shouldn't be political.
Mhm. And I guess from just sort of people's more personal level, I mean, that seems like some big structural things that really need to be
Mhm,
looked at. From a more personal level, most people don't think about the term public health very often.
mhm.
It's easy to get sort of in our own world and day-to-day things. What do you hope that this has been? I imagine this sort of opened up a window into public health mindset for many common people. What do you hope they sort of don't forget in moving forward? Or hope that we've learned as individuals about public health?
Um, I hope people realize how important it is to have a strong infrastructure. I mean, we've been underfunding public health for a very long time in this country, and we tend to forget about it when it's working. We don't invest in prevention, and we like in this country, unfortunately, to invest in the healthcare and the innovation in treatment of disease, rather than all of the systems that should be in place and working to prevent problems from ever occurring. I think we really need to shore up our local public health departments, and make sure that they can quickly adjust and do things like contact tracing and vaccinations, everything. I mean, with many more resources than they've had in the past year or so to do what they're doing.
It seems like public health and what you're talking about is really sort of a resilience of community is what we want to see for community at large, is sort of resilience and adaptability, and then our public health systems as well to be funded enough that they can actually sort of think on their feet and deal with health crises as they emerge.
Yeah, I mean, I think that our field has a real problem in that we're reactive rather than proactive to a lot of the problems we see in our communities. We have so much data now and so much more ability to hone in on what the local problems are, but we don't have comparable funding to address the problems that we see. The funding is driven very much by people outside local communities. So if we changed that structure and had public health professionals relying much less on grant money that comes and goes, and more so on resources that allowed them to build strong relationships with the people who really need it, and help empower communities to create the changes that they know on the ground are needed, I think we'd be much better off.
So I wanted to pivot a little bit now. I know you've done a good amount of work in accessibility initiatives, um, and or at least a good amount of thought into, um, I don't know if specifically ADA compliance, but sort of universal design stuff. Could you speak a little bit to your work and philosophy around that?
Sure. Yeah, I had the privilege of being part of a number of projects in the last 5 years or so where I worked directly with individuals with disabilities to think about how to make health opportunities more inclusive of people with disabilities. And that's the gamut, everyone from mobility um, issues to folks who are deaf, blind, and have a range of different limitations. Um, we worked we worked on a lot of different kinds of projects over time, but um, I think they've been really eye-opening because the disability community is not at the top. It traditionally has not been at the top of mind, I think, when public health folks have been doing their work. Perfect example is, all of those, walking campaigns and take the stairs campaigns that don't really think about people who can't do those things, like people who are outside of who don't move around in wheelchairs. People who use wheelchairs are much more likely to get active if they see themselves represented in the community, um, and we have infrastructure that supports them being out and active. So we've been working with partners here in Syracuse to do things like create wheelchair charging stations out at trails so that folks who use power wheelchairs can go on a hike with their families and friends and not worry about losing a charge when they're out in the woods. Um, we've been working on um, making our bike share program more inclusive by adding some adaptive cycles, recumbent bicycles and hand cycles and things that can be used by just people with a much wider range of abilities. So, there's lots of projects I think are needed, and I'm really proud of the work that the community's been doing here to make those changes happen.
So, in what ways does, aside from the obviously, when you're doing these things, you're helping those individuals be able to be more healthy? Um, are there ways you think that by giving more accessibility and putting public health as a including disability communities in your planning for public health helps the community at large?
Yes, absolutely. I mean, these changes don't just benefit people who identify as having disabilities, they benefit everyone. There are many people, to use the bike example, who don't um, use wheelchairs, but who can benefit from having a three-wheeled cycle or a tricycle, or a recumbent bike, because that's something that keeps them more stable and will allow them to be active more comfortably. A lot of older adults, for example, really don't feel comfortable riding a two-wheeled bicycle, but would gladly get into a different type of cycle that gave them that peace of mind and stability as they rode. So I think these changes have much more reach than just folks with disabilities.
Yeah, I'll add to that from a sort of ergonomic standpoint as someone who works with the body and is trying to, and from getting people to look at their who might be injured temporarily and getting them to look at, well, maybe you can, how can you approach this from a different way where you might not be disabled but still you might benefit from a recumbent bike over a traditional bike in a lot of ways, ergonomically speaking. A recumbent bike is using more powerful muscles, and you're not leaning over and creating postural problems for other things that I would in some ways like to see more recumbent bikes in general. And even if that's not the best choice for everyone, just seeing another option and way of doing things, I feel like can open up people's ideas of what being healthy means.
Yeah, and I mean, I think probably 95% of bike shares in this country only have two-wheeled cycles, and it's really these separate and unequal programs that have allowed these wider range of cycle types to be brought into communities and used by people. Um, and so I think that that needs to change, and that more people need to think about having a wider range of equipment to accommodate a wider range of bodies in their municipal programs.
So as an occupational therapist, disability rights is sort of foremost in mind, at least within sort of the schooling. Um, and a challenge I've always personally had with it, even though I ethically agree with most disability rights concepts and universal design, is you get places like these small towns in Vermont where in order to do any renovation to an old storefront, um, you need to it becomes cost prohibitive for a business to have if they want to redo their bathroom at all, they have to redo it to ADA compliance, which means they might not be redoing the bathroom, and that these streets are not built with ADA in mind, and that it can be a hardship on many individuals, and some projects may just never happen if they have the red tape of having to worry about universal design. And I I'm very conflicted on those challenges, and I was curious if you could speak to that.
Well, I think that it is true. Most of our infrastructure does not accommodate people with disabilities. We don't have, the capacity to, overnight change to a fully accessible, community. And it's very expensive to make these changes sometimes. But I would say it's really important that we do our best to make as many changes as we possibly can, and to look for the funding streams where they exist to try to make those changes happen. I know that some communities have done really great things um, to make it easier and ease the burden on people looking to renovate. Like I heard about this program in Pittsburgh called the One Step program, where they have basically created, easy templates for people to um, pull from if they want to reduce that one step they have outside their business that makes the whole thing inaccessible. And they've gone through the process of working with the city to figure out, the smoothest, easiest way to get these plans through the zoning board and the planning folks, and they help support that change. And I think there were grants to make it happen too. And I'm not from Pittsburgh. I have no firsthand knowledge of this program at all. That's my disclaimer. Um, but I do think it's a concept we need to talk about, is how can we really streamline these accessibility changes that we know are good for everyone.
So if there were just a couple takeaways from this conversation that you would hope that listeners would have from it, what would you hope they remember from this conversation?
Um, yes, I hope people understand that public health is a science, and we base what we do in data and evaluation. We have a lot of expertise in our local public health folks and the CDC, and you don't always get that message from watching the media, but I do think that public health professionals should in general be trusted to know um, what they're talking about, and to be communicating the messaging that, makes the most sense for the whole community, even if it doesn't sit well, even if it changes. It's a science, right? And the science changes over time. And in the past year, we've watched a lot of this with COVID, where the messaging has changed and the guidance has changed. But I think that the public health folks are really responding to the reality of what they know, and that we as a community should trust that they're doing um, their best to make informed decisions for the whole community's health. Long-winded answer. There you go.
Well, thank you very much. It's really been great talking with you today. Thank you so much for your time.
Thanks for inviting me.
It's really great having this conversation with Mary. It makes me think about a lot of different things about community health and resilience at large. I tend to get a little bit too fixated on the health of my individual clients, so it's neat to take the broader step back a little bit and think about how do you, in what way do you implement health for a community at large. In any case, you've been listening to Resilience Radio. I hope you enjoyed this show. If you did, you can subscribe via the podcatcher of your choice. And if you could leave a 5-star review, or a review that you find appropriate, that would be great. You've been listening to Resilience Radio. Take care.